This week we're going to look at a case of a physician here in Colorado who was involved in a fairly significant scheme as it relates to medications and defrauding Medicare, Medicaid. And in this process, this physician almost swept up his MA, his medical assistant, in this criminal event with him. And so let's look at this story and we'll see how it applies to pharmacology issues. The physician is here in Colorado. He worked in a rural town, and in this town he had no partners, no practicing privileges at the hospital. In general, that should be a warning sign that maybe something isn't really kosher there. Not always, but in some cases. This physician is currently serving a prison sentence related to his prescribing habits and the way that he dealt with controlled substances for his patients. This doctor was known throughout the town essentially as being a candy man of sorts when it came to controlled substances. He was known for giving out generous amounts of benzodiazepines, opiates, and phentermine or amphetamines. He was raided by the DEA after several of his patients died of an accidental overdose, and in unraveling the cause of death and the source of the medications that caused the death, he became the common denominator. He became the only thing that tied all of these overdose deaths together. So when he was investigated and his office was closed and the medical records were seized, a couple of practices really cast the medical assistant in a very questionable and difficult light. One of the things that drug the medical assistant into this problem with him was that he was giving controlled substances to patients without actually seeing them in a visit. And you know from our week 4 discussions about controlled substances that they can't be refilled like that. And particularly the Schedule II controlled substances like the amphetamines and the pure opiates. And so you can't just simply continue to write prescriptions for a patient without seeing them when they're on these heavy duty controlled substances. Because he had no partners, because this physician had no partners, anytime he left town or was unavailable, his office was just simply idled, and he had one medical assistant who was working there. He had plenty of patients who needed these medications refilled, these opiates and other controlled substances. And so it wasn't uncommon for the physician to leave prescriptions for his patients at the front desk. In some cases, he actually stuffed the medications in an envelope and then instructed his medical assistant to give that to the patients when they came in and asked for it. Now, it's illegal on every sense, on every front, for a physician to purchase drugs or maintain medications in the office for the purpose of filling their own prescription. And I know that sounds a little convoluted, so to simplify that, the law says that a physician can purchase controlled substances for use in the immediate office. So a dentist who purchases, stocks, and administers Versed or morphine as part of a dental procedure, but if they write paper prescriptions for regular maintenance medications, those have to be taken to a pharmacy and filled by a pharmacist. So you have two choices, essentially, as a physician. You can stock the medications in your office and you can administer them right there in the office, or you can hand your patient a prescription and they go to the pharmacy and get it filled. What you cannot do as a physician is order a whole bunch of medications or controlled substances, write a prescription for them, and then fill your own prescription right there in the office at the same day. So it was illegal for him to do that, and by the letter of the law, it was illegal for the MA to do it as well. At the end of the investigation, it was really clear that she didn't know that it was illegal, and in most cases didn't exactly know for sure what she was doing. She was simply following the instructions. But at the end of the day, this medical assistant was looked at very, very closely for a while. It was not clear to the investigating agencies that this person was not involved and was an unwilling participant. And so although that was ultimately taken care of and resolved, there's no question that there were some tense moments for the medical assistant there, wondering how this was all going to pan out and whether or not she was going to be drug into this in a very significant way. So as a medical assistant, you have some roles related to medications and administering them, reconciling medication lists, and all those kinds of things. So for this week's virtual classroom engagement, I want you to read the articles related to the case that we've just mentioned briefly, and there are some questions to respond to in the discussion board. So I look forward to hearing your answers as it relates to the questions for this case study, and we will continue to move on.